Welcome back to KTN Prime. It's time for that insightful discussion as we analyze the latest updates around the looming nationwide strike by medics that is set to cripple healthcare services across the country starting Wednesday midnight. I'm joined by Dr. Dennis Miskela, who's the Deputy Secretary General at the KMPDU. Daktari, karibu sana. It's unfortunate we're meeting in tough times, especially for doctors. Perhaps let's just start with how the SG is doing. We understand he's still in hospital. What's the progress?
Thank you so much for having me. So as most of your viewers already understand that our SG, Dr. Dabji Atela, suffered life-threatening injuries. In our last demo where he was shot with a projectile on the head, he suffered a cracked skull and brain injuries. He's making a recovery, although he also has some complications that have been arisen, but on medication. Sadly, our captain will be away for the next 6 weeks, but we hope that he'll make a full recovery. If not for the union work, then just for his family and it's for his own good. So that's the issue.
All right,
and as a union, we keep on calling out the Heinous Act for what it is. We know and we keep on saying that it was ill-intentioned, but we thank God that something that could have been worse at least escaped this life. Okay. And we hope that the country that we are building, the Kenya that we're building, we will never have to pay that price for speaking for what we do. As doctors, the only thing we know is to treat patients. Mm-hmm. This issue of being dragged to picket, to demonstrate, is something that is alien to us. And we do it very peacefully. Not even a single person has ever reported even being mugged. Not even a single motorist has ever suffered. And so we don't see why violence should be meted against us, especially when there's a notice given to the police and they're aware of the demonstration.
All right. Of course, the right to picket peacefully and demonstrate is enshrined in the Constitution. We hope he recuperates quite well. Now, the strike commencement date was postponed till Wednesday midnight. It was supposed to start yesterday midnight after key health stakeholders in the ministry actually called you guys from the union for a meeting to try and resolve those grievances. Has the meeting happened? And if so, are there any tangible solutions fronted?
So first of all, as a union, we don't strike for fun. We know that when we strike, patients suffer. When we strike, people may die. And that's why a strike is something that we do as a last resort. Okay. The last time we had such a strike was in 2017. That's 7 years ago. In 2022, our members had mandated us to go for strike because the government had not implemented any of the issues we'd agreed on. We had taken them to court, and the court ordered them to implement some of the things we'd agreed on in 2017. And they, in December last 2022, they called us for a meeting when we gave the notice. And when we met in January last year, January 6th, there was an implementation matrix that was put in place by government that they're going to use to solve the issues. I'm here to report sadly that for the whole of last year, from a meeting with government that used to have full officials, with every subsequent meetings, they kept on dropping off. By the time we were done in December, we were only 3 of us engaging. The report for that conciliation never took place. So that when we gave this fresh strike notice, is when government again started calling us again for conversation. And of course, as KMPDU, we're always gracious. So we were to give a strike notice starting Monday. But we were like, if you are able to invite us and have a discussion, then we will withhold it for a moment, for the goodness of Kenyans. So we withheld it, knowing that strike is not about a broken negotiation. Strike is the beginning of the negotiation. So if somebody can call you to negotiate, then don't throw away that goodwill. So we went for the meeting. But sadly, nothing came out of that meeting. Last week, we also called for a meeting. And as we are doing the meeting, when we step out, we find the CS addressing the media without even being briefed of the meeting. Today, again, we went for a meeting. We find ourselves that the PS has called for a meeting. Then the CS is on another meeting. Then she has another one scheduled another meeting, discussing the same issue. And the union is not aware of all of that. So we end up wondering that, are they really serious about the negotiations?
So you met the PS?
We met the PS in the morning.
Yes.
And the CS also had another meeting waiting to start without us. And another one scheduled with the interns in the afternoon. So there are a lot of confusion and lack of clarity and leadership in the ministry of who is in charge of what. You don't know when you have made progress, when you have not made any progress. So it's very, very frustrating to engage and negotiate with the people who are all over the place.
All right. So as it is, the strike is still on.
The strike begins on the night of Wednesday. The strike notice expires on Wednesday, midnight at 11:59.
Okay.
And that night, when you wake up on Thursday, there will be no doctor. Not because we don't love our patients, but because we are tired of seeing our patients dying from a broken down health system. We are tired of seeing our doctors dying because the system is so broken that it doesn't really care for them.
Let's get to the issues now, because there are an array of issues that you want highlighted by the ministry. You've talked about the implementation of the salary component of that CBA, in which the court ordered on 28th October 2021 that the government should look into. It hasn't happened, as you mentioned. Absorption of healthcare workers once they graduate, it's still an issue. Promotion to get medical insurance, provide jobs for medical interns, to be paid the cost of higher studies, study leaves, and pension from the government. That's amongst the issues you want highlighted. But this is an array of issues. And listening from the government, they say their hands are tied. Hakuna pesa. So is there a compromise position by the union that if you tick these boxes, then we can wait for this as we perhaps dispense the much needed healthcare to the Kenyans?
So just one thing I appreciate that the government has done is that they have acknowledged that all the issues we have raised in that strike notice are valid. They have acknowledged that there is nothing unreasonable that we have asked for. And again, we have waited for 7 years for some of these things. Yeah. One, for example, the interns issue. Medical interns are not students. These are doctors who have graduated 7 years in the university, and after graduating, they have to do a mandatory 1 year internship that you're working but under supervision, so that we can check if the knowledge you learned in school can tie up with the reality on the ground. Then after 1 year, then you're licensed to practice. So when you keep them for 8 months without posting them for the internship, they have no license to go fend for themselves. They are not registered to go work outside. You are locking these young people here.
And they're not applying the knowledge they learned as well.
So what happens is that there's knowledge decay. So either they'll become very dangerous interns, or they'll even take longer for them to learn in internship, or they will get desperate enough to start working under the cover, locking secretly. What happens? They'll kill patients. They'll mismanage patients. They'll be jailed or they'll be fined for doing that. So either way, these are taking time on. And it's not a secret that ever since we began training health workers in this country, people know that every year we have X number of interns who graduate and are due for posting. They are budgeted for every time. And even for the few times out there's a delay in budgeting, ministry always posts them and then pays them when money comes. In fact, as a union, we have gone ahead to negotiate with our circle to give them loans, and we guarantee as a union, so they can start life with it. Then later on, they'll pay back.
But hasn't the ministry said interns can wait until July as they talk to Treasury and whatnot?
The problem with that is that come July, another set is graduating. So they're just going to keep on piling.
I get you.
But more importantly, people who graduated in June last year can't wait for 1 year. For what? When we know that interns make 27% of the health workforce. When you don't post them there, mothers are going to die. Patients are going to die. The queue is going to be longer because of that shortage. Number two is the issue of the medical cover. That doctors had negotiated in the CBA a comprehensive and enhanced medical cover because of the risks we put ourselves into. Then somebody wakes up one day and makes the Social Health Act and says that no comprehensive medical cover. At that time, you have already taken away my medical allowance that will give you that, take this, use it to enhance my cover. You take that away from me, there's no cover. Now, as I speak to you, last evening I was fundraising for a psychiatrist in Eldoret. Terminally ill, can't afford. The other day, there are a surgeon in Kericho. Terminally ill, we have to fundraise. We cannot wait any longer because we cannot be able to offer services that we can't ourselves get. That's the other issue. Then the other issue is the issue around the school fees for people who have gone back to school to study as specialists. We only have 100 oncologists in this country against 55 million Kenyans. So for every one oncologist, cancer doctor, you are seeing more than 500,000 Kenyans. But these people choose to go to school to specialize. You say you're going to sponsor them to go to school. Then what happens when they go to school? The university first triples the school fees. Then Ministry of Health does not pay the school fees. Then they're stuck. You work, study, then when exams comes, you are locked out of exams for a mistake not of your making.
So it's an array of issues as you've highlighted. And is there a compromise, as I asked? Is there a compromise position that the union says, if you tick this box, then this can wait as we deliberate on them? Is there a compromise, briefly?
Yes, of course, in negotiations there are give and takes. But there have to be a concrete offer. Sadly, the only offer government has offered is out tied, the hands are. So maybe we give them some time, then we can untie it. Sometimes you'll be shocked at the miracles that a strike can do.
As you said, it's a last resort, of course.
Yes.
But it's proper to note that the ratio of doctor to patient in the country is definitely wanting 1 to 17,000. So much more focus should be put into this. In terms of posting medical interns, according to the State Department for Public Health, they say they've posted 4,129 interns. In terms of looking for a lasting solution to this debacle, as you said, July, another cohort is coming out. Do you think the operationalization of the Kenya Human Resource for Health Advisory Council will tackle these challenges? Briefly.
It will never happen because we have the declaration that KHRAC had made that had promised to sort out all the issues we have given. But ever since we gave the strike notice, they've never talked because the counties won't listen to them and the MOH won't listen to them. Kenyans must know that when a doctor is not there, when the intern is not there, the mother who is due to theatre will delay and might die. That man who needs to go for surgery will have to wait for 3 months. That mama fua will have to wait in the morning and ask themselves, if I go to the hospital, I'll wait for 5 hours. Will I go to my daily wages, or do I take this child to the hospital? You will choose to go make money. When you come back, the baby will be dead. Women and men and families have to pay the painful price of a broken healthcare system, of serious staff shortages, no drugs, no equipment. And every time we raise these issues as unions, we are being told you are being unreasonable. Right now, they put shift in place. They're doing the KEMSA reforms. They're building hospitals. But there are no healthcare workers inside those hospitals. Instead, they feel we are training, they're exporting to other countries.
But they're trying to buffer the numbers up with community health promoters.
But I agree with you. But do you know that these community health promoters are not trained healthcare workers? The only thing you qualify to be a community health promoter is to be a living human being. And they give them kits, they give them drugs to walk around. And when you ask them that, when the CHPs go and create the need by telling people to go to the hospital, when they arrive there, they have been told you have hypertension because they took some BP. Then you find there's no doctor in the hospital. You find there's no medicine. You find there's no lab working. Then why do you tell this woman that she has hypertension if you know you're never going to treat her? You have just made her more stressed and worsen the situation. So don't create a need when you have not fixed the end game. Healthcare comprises of 4 things: drugs, infrastructure, healthcare workers, and how to finance the system. You have already started the financing by putting the shift in place. You have already done the KEMSA reforms. You have built the hospitals. What is so hard in us having a conversation as a country on the human resource? When you bring that as a union, you are being told, no, health is involved, go to the county. When you go to the county, they tell you, no, the money should come from a treasury, we have not received money. So what is what? Kenyans voted for one president, one government. He made a promise in his manifesto that they employ 20,000 healthcare workers. I want to look at the president and ask him that you made a promise, not just to the healthcare workers, to the Kenyans. Crack the whip, Mr. President, and call the COG to order. Call the MOH to order. Because ultimately, those who are going to suffer are the hustlers who voted for you, knowing that for once, the voice of that poor woman is going to be heard once and for all. They have suffered enough. Healthcare workers, today I've lost 4 doctors this year alone from suicide because of the frustrations that they are undergoing in the counties. And nobody seems to feel their pain. I don't think that the life of a doctor is less worthy than any other person's lives. Please, take care of the carers for them to take care of you.
Well put. Daktari, we definitely hope for a working framework, of course, between the healthcare officials at the ministry and the union officials in order to reduce these incidences of strike, which you said is a last resort that cripple actually the all-important healthcare services in the country. So according to the Deputy SG, the strike is still on Wednesday midnight. Doctors will be downing their tools and we can expect that effect to be cascaded down across public hospitals. Dr. Dennis Miskela, thank you so much for your time. He's the Deputy Secretary General at KMPDU. We take a short break, but coming up, just ahead in business, Hustler Fund borrowers graduate to larger